Chapter 8 is TRICARE and Veterans Healthcare. Our objectives discuss the history of TRICARE, state who is eligible for TRICARE, list the circumstances when a non-availability statement is necessary, differentiate between authorized and non-authorized providers, explain the benefits of the TRICARE Select government program, state the TRICARE fiscal year, state the managed care features of TRICARE Prime, and discuss enrollment, primary care managers, pre-authorization, and payments. Define individuals who enroll in the TRICARE Prime remote program and discuss enrollment, pre-authorization, and payments. Discuss TRICARE Reserve Select, TRICARE Retired Reserve, and TRICARE Young Adult programs. Explain TRICARE for Life benefits and those who are eligible individuals. Name individuals eligible for TRICARE Plus and discuss enrollment, pre-authorization, and payments. Discuss the supplemental health care program, including enrollment and payments. Discuss the TRICARE Hospice program. Identify individuals who are eligible for the Veterans Health Administration program, known as CHAMP VA, and discuss enrollments and pre-authorization. Describe how to process a claim for an individual who is covered by various types of TRICARE programs. State the components of a TRICARE summary payment voucher. List the components of a Veterans Health Administration, CHAMP VA, explanation of benefits document. So we start with the history of TRICARE. In 1966, the Civilian Health and Medical Program of the Uniformed Services, known as CHAMPUS, was created to fund comprehensive health benefits for military members and families. In 1988, CHAMPUS Prime, a managed care plan, was created to control escalating medical costs. Military members and dependents then had a choice of plans. In 1994, TRICARE became the new title and options were expanded to include three choices. TRICARE Standard, which was a fee-for-service plan, TRICARE Extra, which was a preferred provider organization, known as a PPO, and TRICARE Prime, a health maintenance organization, or HMO. In 2005, TRICARE consolidated into three regions. The three regions of TRICARE in the U.S. are Region West, Region North, and Region South. And TRICARE programs meet standards set by the 2010 Healthcare Reform federal legislation. For eligibility, this is for active duty service members, eligible family members of active duty service members, military retirees and eligible family members, surviving eligible family members of deceased active or retired service members, wards and pre-adoptive children, and former spouses of active or retired service members must meet the requirements. Eligible family members need to meet specific requirements to be covered under TRICARE. And a beneficiary is an individual who does qualify. Also, family members of active duty service members who were court-martialed or separated from their families for abuse, abused spouses, children of service members, spouses and children of NATO nation representatives, reservists and National Guard members activated for 30 or more consecutive days, disabled beneficiaries under 65 years with Medicare Parts A and B, and Medicare eligible beneficiaries in TRICARE for Life. A person retired from the military is a service retiree and remains in TRICARE until age 65. Then the person can join the TRICARE for Life program if eligible for Medicare. No further family benefits are provided if an active duty service person served 4 to 6 years and then chose to leave the armed services. And Veterans Health Administration beneficiaries are not eligible for TRICARE. Defense Enrollment Eligibility Reporting System, known as DEERS, is a computerized database system in which all TRICARE eligible persons must be enrolled. No claims can be processed without prior DEERS registration. A TRICARE beneficiary can check status at the nearest personnel office or call the DEERS toll-free number. An NAS non-availability statement is a certification from a military hospital when it cannot provide care. As of December 2003, it's not needed for individuals in the catchment area surrounding an MTF, and an MTF is a military treatment facility. A catchment area is a specific geographic region defined by zip codes. It's based on an area of approximately 40 miles in radius surrounding each United States military treatment facility. ID cards are required for all dependents over the age of 10, not limited to using network providers for medically or psychologically necessary services. Care is usually sought at military hospital closest to home or identified through the HCF, Healthcare Finder. Authorized providers must be used. Pre-authorization is necessary for specialty care, hospitalization, and certain procedures, and deductibles and copayments do apply. Uniformed Services identification card is necessary. The front and back should be copied. If there is no military service hospital in the area, the patient may be directed elsewhere. Partnership program is an option for treatment by select civilian providers of care in a military hospital or military providers in a civilian facility. Use of non-authorized providers may result in non-payment. Authorized providers include doctors of medicine, doctors of osteopathy, doctor of dental surgery, doctor of dental medicine, doctor of pediatric medicine, certified nurse midwives, and clinical social workers. The TRICARE fiscal year begins on October 1st and ends September 30th. This is different from other programs, therefore, office staff should be alerted when collecting deductibles. An authorized provider is a physician or other individual authorized provider of care, or a hospital or supplier that is approved by TRICARE to provide medical care and supplies. Authorized providers for TRICARE include what we listed earlier: doctors of medicine, osteopathy, DDS, DDM, DPM, certified nurse midwives, and clinical social workers. If services are not available, the Healthcare Finder can assist with the referral or pre-authorization process. Deductibles and copays are determined according to two groups: active duty family members and then retirees, their family members, and survivors. A participating physician is a physician who has signed a participating provider contractual agreement with TRICARE to give medical care to TRICARE beneficiaries. We already read through this one. Oh, sorry. This is for TRICARE Select. It looked similar to the previous TRICARE. Okay, so TRICARE Select, an ID card is required for all dependents over the age of 10. The PPO option, Preferred Provider Organization. The network provider must be used. Pre-authorization is necessary and coordinated by Healthcare Finder for specialty care, hospitalization, and certain procedures. And again, deductibles and copays do apply. Network providers is the physician providing care at the contracted rates. There is no annual fee to enroll in this PPO option. For TRICARE Prime, voluntary health maintenance organization HMO option with an annual fees required. Minimum of 12 months participation is required. The primary care manager coordinates all care except emergencies. Referral from Healthcare Finder required for use of non-network provider. Pre-authorization may be necessary for some specialty care, hospitalization, and certain procedures. Copayments and deductibles apply. The PCM is the primary care manager. He or she is a physician. Enrollment card or ID card is necessary but does not guarantee eligibility. The TRICARE Prime card must also be copied for the file. TRICARE will not pay anything on a claim if the HMO has specialty services providers, but the patient goes outside the HMO for treatment. A Health Benefits Advisor, HBA, should be called to determine if an NAS is needed for a procedure done outside of a military training facility. The TRICARE Prime Remote Program. This is for active duty service members only. Must live at least 50 miles from a military treatment facility. Has the same benefits as TRICARE Prime. No prior authorization for routine primary care. The primary care manager coordinates all care except emergencies, and there's no out-of-pocket expenses for in-network services. Family members are not eligible, but they can enroll in TRICARE Select or Prime. TRICARE Reserve Select, available to qualified members of the selected reserve and their families, and it's similar to TRICARE Standard and Extra. Enrollees must not be eligible for or enrolled in the Federal Employee Health Benefits Program or currently covered under it. TRICARE Reserve Select can include Army National Guard, Army Reserve, Navy Reserve, Marine Corps Reserve, Air National Guard, Air Force Reserve, and Coast Guard Reserve. TRICARE Retired Reserve, or TRR, premium-based health care plan available for purchase by qualified retired reserve members and survivors. TRICARE Young Adult, or TYA, is a premium-based health care plan available for purchase by qualified dependents. TYA offers TRICARE Select or TRICARE Prime coverage based on the sponsor's status. TRICARE for Life is a supplementary payer to Medicare. There's no separate ID card, no referral or pre-authorization requirements, and payment is based on the services provided and coverage by both Medicare and TRICARE. It was originally introduced as TRICARE Senior Prime for retirees, including Guard and reservists and spouses, survivors age 65 or older. Not for dependent parents or in-laws. Pays secondary to Medicare when beneficiary turns 65. Must be eligible for Medicare Parts A and B. All services and supplies must be benefits of Medicare or TRICARE to be covered. TRICARE Plus, an ID card and DEERS enrollment is required. Enrollees use the military treatment facility as the source of primary care. Same benefits as TRICARE Prime when using military treatment facility, and access to specialty providers at military treatment facilities not guaranteed. Open to persons for care in military facilities but not enrolled in TRICARE Prime or commercial HMO. SHCP, Supplemental Healthcare Program, for active duty service members and other designated patients, enables beneficiaries to be referred to civilian providers when needed. No deductibles or copays if military treatment facility initiates the referral. Inpatients at an MTF who are not TRICARE eligible, such as parents and in-laws, are covered. Those receiving benefits are not responsible for any out-of-pocket expenses. The TRICARE Hospice Program is based on the Medicare Hospice Program for life expectancy being 6 months or less. Cannot also receive care under TRICARE basic programs. If condition changes, hospice care option can be revoked and patient may again be eligible for TRICARE basic programs. Guidelines should be followed to ensure that specific services are covered. TRICARE and HMO coverage. Provider must meet TRICARE provider certification standards. Type of care must be a TRICARE benefit and medically necessary. TRICARE does not pay for emergency services received outside the normal HMO service area. TRICARE will share the cost of covered services with an HMO if the listed criteria are met. TRICARE will not pay for services outside the HMO if the services are available through the HMO. Veterans Health Administration Program. In 1973, the Civilian Health and Medical Program of the Veterans Administration, known as CHAMP VA, was created. It's now called the Veterans Health Administration. It's for spouses and dependent children of veterans with total permanent disabilities. It must not be eligible for TRICARE Standard or Medicare Part A. It is a service benefit program. CHAMP VA is not an insurance program and there are no premiums. Again, it is a service benefit program. A veteran must have a total permanent service connected disability or must have died as a result of the injury disability. Disability must be permanent and not chronic or temporary. Children are those unmarried under the age of 18 or under 23 if enrolled in an approved educational institution. An IDs card is required for all dependents over the age of 10. Benefits are similar to TRICARE Standard for dependents of retired and deceased military personnel. Freedom of choice in selecting civilian providers, and pre-authorization is needed for some services. And some examples of the services pre-authorization might be required: dental services, hospice care, organ transplants, mental health treatment, and several other situations as well. TRICARE Select is administered by the DoD, the Department of Defense. Veterans Health Administration Program is administered by the VA, Veterans Administration. Claims must be billed on the CMS 1500 form or electronically and submitted to the correct fiscal intermediary and filed within 1 year of service. They're not subject to regulatory agencies that control the insurance business. Regional contractor, or fiscal intermediary is the claims processor or designated insurance contractor. TRICARE Select and TRICARE Prime. No claim forms are filed by the beneficiary if care is provided in network. Providers must use the CMS 1500 form or electronic system to submit claims. You should submit claims to the correct subcontractor and make sure to file within 1 year of service. A contractor may grant exceptions from filing deadlines if a complete explanation of circumstances, all available documentation, and the denied claim are included with the request. TRICARE Prime Remote and Supplemental Healthcare Program. Outpatient services are submitted with the CMS 1500 form or electronically. The POS, Point of Service option, and non-availability statement, NAS requirement do not apply, and claims must be filed within 1 year of service. Claims for active duty patients must be sent to the specific branch of military service. For TRICARE for Life, civilian provider submits the claims to Medicare to pay first, and then the claim is submitted to TRICARE for the remainder. Medicare automatically forwards the claims to TRICARE after paying the first portion. For TRICARE, Veterans Health Administration, and other insurance, TRICARE and Veterans Health Administration usually pay as secondary payer if the beneficiary has other health insurance. An EOB, explanation of benefits, copy from primary carrier should be attached to the completed CMS 1500 claim form. Include a copy of the physician's complete itemized statement. The claim should then be sent to the local claims processor, another name, fiscal intermediary. Other insurance options include the Civilian Health Plan, HMO, and PPO. Two exceptions: plan administered under Social Security Medicaid Title 19 and coverage designed to specifically supplement TRICARE benefits, such as Medigap. Physician statements should include the name, date of service, service description, fee, and procedure codes. For Medicare, TRICARE is always secondary if under 65 with Parts A and Part B. Veterans Health Administration is secondary if under 65 with Part A and Part B. If under 65 with Medicare Part A, they must be disabled to qualify for TRICARE. Services covered by TRICARE but not covered by Medicare, for example, prescriptions, are paid by TRICARE. For coordination of benefits, it's needed for situations with dual coverage, so there is no duplication of benefits paid. TRICARE pays the lower of the amount of TRICARE allowable charges after the other plan has paid the benefits, and the amount TRICARE would have paid as primary. The beneficiary who refuses to claim benefits from other health insurance coverage risks denial of TRICARE benefits. Third-party liability. TRICARE Form DD 2527 submitted with the regular claim form CMS 1500. Provider can submit claims only to third-party liability carrier for reimbursement. Claims submitted with ICD-10-CM diagnostic codes between S00 through T88 may trigger the fact that there may be third-party litigation, and the claims processor may request completion of Form DD 2527. For workers' compensation, TRICARE and CHAMP VA billed when workers' comp benefits are exhausted. The beneficiary with work-related injury or illness must file the claim with the workers' comp carrier. The after claim submission, TRICARE, for each claim, a summary payment voucher is issued to the patient. This details the payment of the claim, allowable charges, amount billed, amount TRICARE paid, how much deductible has been paid, and the patient's cost share amount. The summary payment voucher details the claim payment by the processor. If provider receives direct payment, the patient still receives the copy of the voucher. For Veterans Health Administration, for each claim, an explanation of benefits document is issued to the patient summarizing actions taken. The explanation of benefits is issued to the patient even if the provider is paid directly. Quality assurance continually assesses the effectiveness of inpatient and outpatient care, and claims inquiries and appeals. Providers may request reconsideration of a denial of certification for coverage or of the amount paid for a submitted claim. Our summary of Chapter 8, TRICARE is a 3-option managed healthcare program offered to spouses and dependents of service personnel with uniform benefits and fees implemented nationwide by the federal government. It also covers retirees, reservists on active duty after 30 days, widows, and widowers. An electronic database called Defense Enrollment Eligibility Reporting System, or DEERS, is used to verify beneficiary eligibility for those individuals in the TRICARE program. The TRICARE fiscal year begins October 1st and ends September 30th. There are certain referral and pre-authorization requirements for TRICARE standard patients. If the physician agrees to accept assignment in a TRICARE standard case, the participating provider agrees to accept the TRICARE determined allowable charge as payment in full. The provider may bill the patient for his or her cost share or coinsurance, 20 to 25% of the allowable charge after the deductible has been met, and for any non-covered services or supplies. TRICARE Prime is a voluntary HMO type option. TRICARE for Life is a healthcare program that offers traditional TRICARE benefits and is a supplementary payer to Medicare for uniformed service retirees, their spouses, and survivors age 65 or older, and certain former spouses. TRICARE Prime Remote is a program designed for active duty service members who work and live more than 50 miles or 1 hour from military treatment facilities, such as military hospitals and clinics. The Veterans Health Administration, known as CHAMP VA, is a service benefit program similar to TRICARE and is for veterans with total permanent service connected disabilities or surviving spouses and dependents of veterans who died of service connected disabilities. TRICARE and CHAMP VA claims must be billed on the CMS 1500 claim form and submitted to the regional contractor for processing within 1 year from the date a service is provided, or for inpatient care within 1 year from the patient's date of discharge from a facility. The Computer Matching and Privacy Protection Act of 1988 permits the government to verify TRICARE patients' information by way of computer matches. For each TRICARE claim, the claims processor issues a summary payment voucher that details the payment of the claim to the provider and sends a copy to the patient.